How does light trigger seizures in people with epilepsy? Imagine flickering lights on a screen or flashing patterns that suddenly catch your. For some people with epilepsy, these visual stimuli can unexpectedly set off a seizure. This phenomenon is known as photosensitive epilepsy, and it happens because certain types of light can cause abnormal activity in the brain. When a person with this condition sees flashing or flickering lights, especially at specific speeds, it can trigger a seizure by making nerve cells in the brain fire in a synchronized way. Normally, neurons in the brain communicate in a coordinated but individual manner, like many fingers playing different notes on a piano. But flashing lights can cause many neurons to fire together at the same time, creating a hypersynchronous burst of activity that spreads across brain networks and leads to a seizure. This process is most often linked to light flashing at frequencies between 3 and 30 flashes per second, with the range of 10 to 25 flashes per second being particularly likely to provoke a response. The brightness of the light also matters. Brighter lights are more likely to trigger seizures, especially if they fill a significant part of the visual field. Usually, the stimulus needs to be seen by both eyes and cover at least 10% of the visual area to have a strong effect. The visual cortex, which processes what we see, and the thalamus, which relays sensory information and influences other parts of the brain, are key players in this process. When these areas respond excessively to certain visual inputs, they can initiate the abnormal electrical activity that characterizes a seizure. Seizures caused by light can take many forms, including convulsions, staring spells, muscle jerks, or partial seizures. The exact way this happens is complex and not fully understood, but the main idea is that the visual stimulus causes neurons to fire in a highly synchronized way, which can then spread and trigger a seizure. For people with photosensitive epilepsy, avoiding exposure to flashing lights, strobe effects, rapidly changing patterns, or certain video games can help reduce the risk. Sometimes, covering one eye can lessen the effect because the seizure-inducing stimulus is often stronger when both eyes see the flashing pattern. Doctors often use an EEG test with flashing lights to identify sensitivity without causing a full seizure. In summary, light triggers seizures in susceptible individuals by causing excessive, synchronized activity in the brain's visual pathways. Managing exposure to flashing lights and patterns is an important part of living well with photosensitive epilepsy. If you or someone you know has this condition, it's best to work with a healthcare professional to develop personalized strategies to minimize triggers and stay safe.